What are the visual differences of stroke types on scans? Imagine trying to tell two very different stories just by looking at images of the brain. That's what doctors do when they analyze scans to identify stroke types. There are mainly two kinds of strokes, ischemic and hemorrhagic, and each has a distinct look on imaging tests. Understanding these differences is crucial because treatment depends on the exact type. Starting with ischemic strokes, these happen when a blood clot blocks blood flow to part of the brain. On a non-contrast computed tomography scan or CORT scan, early signs can be subtle. Usually right after the stroke, the scan might look normal. But after about 12 to 18 hours, you might see areas that look darker than usual. These darker regions show where the brain tissue is swelling or has lost its normal density, a sign called hypodensity. Sometimes, a bright spot called a hyperdense vessel sign appears, indicating a clot inside a blood vessel. Over time, these areas may become more clearly defined, showing more swelling and tissue loss. On magnetic resonance imaging, or MRI, the story is different. Diffusion-weighted imaging, a special MRI technique, can detect ischemic changes within minutes. The affected areas appear bright or hyperintense because water movement is restricted in damaged cells. Corresponding ADC maps show dark or hypointense regions, confirming the presence of ischemia. Days after the stroke, T2-weighted MRI images may show hyperintense signals as the brain responds to injury. Now, hemorrhagic strokes are caused by a blood vessel bursting and bleeding into the brain tissue. On a CORT scan, these are usually easy to spot. Blood appears bright white immediately after bleeding because of hemoglobin. This hyperdense appearance makes hemorrhages stand out clearly against the normal brain tissue. The bright white areas on the scan indicate fresh bleeding, whether inside the brain tissue itself or in the space surrounding the brain. Over time, as the blood breaks down and gets absorbed, the bright areas fade and the appearance changes. MRI scans, especially those using susceptibility-weighted imaging or gradient echo sequences, are very sensitive to blood products. They show hemorrhages as areas of signal loss or blooming artifacts, which help identify the stage and extent of bleeding. Different stages of blood breakdown produce various signals on T1 and T2 images, but the key point is that hemorrhages are usually visible as dark or blooming areas on these specialized sequences. Knowing these visual differences is vital because they guide treatment. For example, ischemic strokes might be treated with clot-busting medications or procedures to remove the clot, but hemorrhagic strokes requiring careful management of bleeding and pressure inside the skull. Non-contrast CORT scans are often the first step because they are quick and widely available, mainly to rule out bleeding. MRI, especially diffusion imaging, is more sensitive for early ischemic changes but is less accessible and takes longer. Advanced techniques like CORT angiography can also help visualize blood vessels and assess blood flow. In summary, on CORT scans, ischemic strokes look like darker areas that develop over hours due to tissue swelling and loss of density, while hemorrhagic strokes show up as bright white spots caused by blood. On MRI, ischemic strokes appear bright on diffusion-weighted images early on, indicating restricted water movement, whereas hemorrhages show characteristic signal changes on sequences sensitive to blood products. Recognizing these differences helps doctors quickly determine the type of stroke and start the right treatment. Always remember, if you or someone else shows signs of a stroke, seek emergency medical care immediately for proper diagnosis and care.